So welcome back to the Voices in Health and Wellness podcast, where we explore the people and ideas reshaping how we think about health, prevention and long-term well-being. Today, I'm joined by Dr Ashanthi Gajaweera, a neurologist with over 2 decades of experience who made a bold shift from traditional medicine to build something she felt was missing. She's the founder of HealthSpan Neurology, a preventative neurology practice focused on helping people reduce their risk of cognitive decline and dementia, often decades before symptoms begin. Her work is grounded in evidence, cutting through the noise of gimmicks and pseudoscience, and she brings a particularly valuable lens through her expertise in menopause and how hormonal changes impact brain health. So with that, Ashanthi, I'd like to welcome you to the show. Thank you so much for joining us today.
Thank you so much for having me here. This is going to be a lot of fun.
I'm looking forward to it as well, and we have some common interests, so I'm really looking forward to the discussion. But perhaps to start, could you share a little bit about your journey from traditional neurology into building HealthSpan Neurology?
Yeah, of course. So thank you for having me here. I love hearing your podcast about how other people are navigating this untread path, right? So I am a general neurologist. I've been in practice now for nearly 23 years, and most of that time in Rochester, New York, where I have a brick and mortar practice. I practiced within a traditional insurance-based model for 22 of those years. And then in 2025, I opened my independent practice, HealthSpan Neurology, where I focus on patients with dementia risk factors. And I have a dementia prevention and cognitive longevity model of care. Getting here has been somewhat straightforward because I've always really been interested in preventive medicine, but it's not really the model of care that is one within an insurance system. But I knew that this was where I wanted to be one day. It was just a question of how I was going to navigate the system we are in to get there.
Got it. So you said 2025, and I'm just really curious to know, was there a particular moment or series of moments that made you realize that the traditional model isn't just quite enough for me?
Well, I think that started back in 2010, actually. So in 2010, there was dramatic changes within the U.S. healthcare system. And I was within the practice I was the managing partner. So I did I worked with the billing, I worked with the hiring, I did kind of all of the back end stuff that I don't think most physicians, especially given the dwindling numbers of private practice physicians in the US at least are. I don't think most physicians were acutely aware of the changes that were happening, but I was, and I saw the writing on the wall in terms of this is financially difficult. We're going to have to change the model of how we work. And if we don't, then we're going to get overwhelmed with checkboxes and just becoming administrators in one more cogwheel of medicine, or one more cog in the wheel of medicine. And I didn't necessarily initially think I would leave because I felt such a responsibility to my patients and my practice and my staff. But I tried to make that work. So I did other things. So I got licensed in medical acupuncture. I myself have a longstanding mindfulness practice. So I became certified in mind-body medicine. And I tried to incorporate these things into my traditional practice. But as much as I tried, it really wasn't practically possible. It was neither something that would be reimbursed. And it was, even more importantly, I think it was costing me money, because to try to incorporate these kinds of things into a traditional model is just not, it doesn't lend itself to the 15-minute visits that we are reimbursed for. So, my 45-minute, 1-hour visits were just not feasible in that model. So I tried for a while, but then I think COVID really strained most private practices and reimbursement issues. And I think as I saw those issues mounting, I knew that I was not going to stay happy in medicine. So it was a matter of losing my joy in medicine maybe even sort of becoming permanently unhappy in a joyless state. Or I think what came over me was I am a problem solver and I am incredibly bright. And why deal with this when I can figure out a way? There has to be a way out of this. And the way for me was not within an insurance-based system, because I had tried that. I had tried really hard, in terms of time, money, just the amount of investment I had already put into that was not something I thought I could continue. So I was 52, I think, at the time that I started, 51, 52 at the time that I started thinking about leaving. And I have to admit, it was kind of a question of, do you retire? Because, it's not to say that life is going to be easy, but do you just do locums and suck it up once in a while? Or do you do something different, something new, build something? And so I decided, let's build something. That's, my kids were going to college around the same time. They were building something, and it's a good time in life to show them what is possible. So those were my motivators.
Fantastic. So could you perhaps give us an overview of HealthSpan Neurology and how you've sort of created a better world in a more holistic approach that you've been talking about just now?
Yeah, so I started the practice, like I said, just under a year ago, and I have a cognitive longevity program. So the way that is framed is it's a 6-month to 1-year program where I see patients over 3 to 4 visits. And we start by the first visit assessing their goals, their risks, their history, their family history. And then the second and third visits are reviewing their diagnostic testing and then assessing how those risk factors, both objectively and subjectively, come together and what strategies we can then put into place in a targeted, effective way to mitigate risk as much as possible. As you know, there's a million things you can be doing for dementia prevention, but to tell people to do these million things is rarely feasible or practical. So it's very much getting to know the patients, getting to know what's important to them and what works in their lifestyle so that we can incorporate a stepwise strategy and then build on it over the course of a year and give them ways to then have a roadmap to follow, whether that's working with me down the road or working with their primary care doctor. I just started about a year ago, so I don't have people that I've sort of let out into the wild, shall I say, to see how that's working. But I think that I at least give them an idea of where their risks are most, where it's most worthwhile to put their efforts. And that way they can stay focused, goal-oriented, and have objective things that they can try to follow over time. I think that I'm a very logical, data-driven person. I was once an engineer, so I think I think in spreadsheets and I think in charts, and I believe that helps patients. But at the same time, I feel like my years of experience allows me to give patients a practical, stepwise way of doing things that isn't just a spreadsheet that you need to then follow. It's a game plan that's accessible. So that's the crux of what I do. I have a Mind Over Menopause program as well, which I think is fun and interesting and useful. Neurology and OBGYN don't often fall under the same training pathways. We rarely consult each other, I think. And I decided once I started to do a focus in dementia prevention that to really understand it better, I needed to understand menopause better, given the increased risk for women. And I became a Menopause Society certified practitioner, which has been quite elucidating just in terms of my own health, the health of how I've approached patients over the years, whether that's for dementia prevention or anything like migraines and epilepsy. I think that all of these are so interwoven in terms of hormones and neurologic health. So it's really opened my eyes into how to practice and be more holistic in terms of my approach to caring women with neurologic disorders, whether that's from a preventive standpoint or just just dealing with neurologic disease. So that's the model that I work with. I also try to incorporate some mindfulness into my work. It's I think a sometimes tentative path, because not all patients want to go that route, but I think it's something that I try to make accessible to them if that's something they'd like to do.
Thank you. With the prevention program, the dementia prevention program, are you working primarily in prevention with people who are at risk, or are you seeing patients who've actually got some evidence of cognitive decline? Are you seeing that for the full spectrum of patients?
So it's a great question. And I think that's something I'm actually working with right now in figuring out how to do it. What I've been doing is a prevention model. So patients who are without symptoms, but who are concerned based on a family history or brain injury, or having symptoms that they think, for example, are menopause-related brain fog. I am starting to see more patients with the earlier signs of mild cognitive impairment where they don't test within an MCI range on cognitive testing, but they feel like there's a change. And in talking to them and knowing what their either professional or life background is, the subjective functional change is one that makes me think that there is something different about them. So for those patients, I do first an assessment, like part of it as just a neurologic consultation, and then I incorporate that into my dementia prevention program if I think that they have the ability to take that on. It is a lot of work and commitment to engage in a dementia prevention program in earnest for a patient, and I want to make sure that they have the wherewithal, the support to do it, rather than feeling overwhelmed or feeling that if they don't do everything, then they are missing out or that they are failing themselves or their family. So I think I don't want to over-promise to patients that might already be in the lower MCI range or with early dementia. That's my way of practicing. I think that others might see it differently, but for me, my dementia prevention cognitive longevity model is really mostly for the asymptomatic preclinical patients.
Got it. And what's your hope for these patients at the end of their 1 year? Is it really to give them the roadmap and to make them self-sufficient, and what's their expectations for a program, for 1 year with you as well?
I think so. My goal with them is that they feel empowered, that they know what's important. In terms, there's, like I said, even if you think of, there's a million things you could be doing, and there's probably 10 pillars of things you can be doing. And then in terms of those pillars, which mechanisms are most important? So what I really try to do is break it down into not just which pillar of cognitive health is important, but which mechanisms are going to feed that pillar the best for an individual. So for some, that might be metabolic. For some, that might be inflammatory. And if you know which mechanisms are most important for your phenotype, then you can focus on that. So that's really my goal, is to give them that empowerment. And I'll be honest, I'll have to see how patients work with that down the road. I do have a model of having patients return to see me every 6 months or a year, depending on how what works for them. But I try to give them that after that last visit a summary of what I think I'd like them to be looking at in the next year.
Thank you. So you've taken a very clear stance against pseudoscience and quick fixes. What are you seeing in the brain health and prevention space right now that sort of concerns you, or something that you're kind of steering yourself away from?
Yeah, so I think there's two parts of that question, and I think it's probably one of the most important questions for somebody who's going down this atypical path, shall I say. And once you get off the beaten track, it's a jungle out there, right? It just feels like, wow, you could be doing so many things, and there's not the ivy tower to rein you in, or the you've already perhaps are being thought of by your peers as that sort of odd doctor doing something a little weird. So, sky's the limit in terms of weirdness now. And so to rein yourself in I don't mean rein yourself in, but to follow your path, I think for me, it has been a question of what feels aligned with my what I think is true, what I think is morally aligned with how I want to practice, and is something that I will feel is not going down a path that's going to be distracting for me. So, for example, many patients will call and ask if I do certain types of infusions or if I do certain types of protocols that I think it's not to say that they don't have validity. I think they do. It is just a question of whether that is the path that I want to take my patients on. And it can be tempting to want to do those things because they are profitable. They are, when building a practice and when going outside the system and you don't have this predictable revenue stream or predictable patient stream, it can be easy to go down a path that might be what your patients are asking for rather than what is true to what you want to do. So how do I navigate that is the evidence for that enough for me to want to recommend it to people? And is it something that once I go down that route, I'm going to be consistent in how I feel? Doesn't mean you can't change your mind. It doesn't think about something, but rather that you don't go down a slippery path, put it that way.
Got it. So why do you think there's still such a gap between what patients are asking, like, how do I prevent this, and what the conventional system is able to provide?
Well, I think the conventional system isn't able to provide it for a number of reasons, but I really think the biggest, beyond the time, beyond the reimbursement, I think in dementia prevention, the biggest hurdle is that this is not intrinsically something that falls under a neurology or psychiatry silo. And we practice in silos of medicine. And within neurology, it's even more siloed. I think that I feel like I'm one of the last of a generation of general neurologists. Even though I fellowship trained, I practiced in general neurology. So I saw everything, and seeing everything then allows you to have sort of a confidence to do things that you're not always the expert in, right? So, and that means within a dementia prevention model, accepting that dementia isn't just amyloid. There's so much more, if not much, much more than amyloid theory in terms of addressing dementia. So it's being comfortable with managing or assessing cardiac issues, metabolic issues, all those things that I just talked about, which I think most neurologists are a bit shy of doing. And I think that comes from being so subspecialized today that many, for example, epilepsy doctors won't manage migraine. So if you can't manage migraine, how are you going to manage somebody's lipids? So it's so outside your bandwagon that I think it is very difficult to to get your hands around it. So I think that family medicine doctors and internal medicine doctors would be able to do this really well. And then, but in that case, it's a question of perhaps understanding dementia better and understanding how to assess it and diagnose it and manage it, and imaging and all the biomarkers, but it's not rocket science. I feel like it's something that we can build as a model of care if it just became less out there, less sort of suspect. And maybe that goes into, sorry, I'm just going to keep going, that I think that patients are asking these questions because, and maybe asking these things that are outside of the science because they aren't getting answers from their neurologist. So they're left on their own. So when they go on their own, they're being fed by sort of the social media and the sort of the fringe medicine that can easily speak where all doctors are stuck to their randomized controlled trials and evidence-based medicine.
Yeah, that completely resonates. I completely get it. So can you share a little bit about your role now on a day-to-day basis as a founder versus when you were in traditional practice before?
Yeah, so I spend a lot of my day now managing my time. And that is probably one of the biggest changes for me. So, as a physician, you spend your entire adult life with somebody telling you what to do, right? Whether it's residency or in clinic, you walk in and your schedule is set. And now it's really a matter of figuring out how to manage my time when I'm not seeing patients. A lot of my time is spent in trying to, I guess the best word is market myself, market my brand, market my product, and build my practice as one that is worth patients looking at. So because dementia prevention isn't something people even know they need, it's a tricky thing I'm trying to basically sell something that people don't even know that they need, much less that it exists. So that's actually how I spend a fair amount of time in terms of like social media, YouTube, education, webinars, speaking events. It's really outside of my comfort zone, but it is important. It is good for me. It's certainly building my cognitive resilience as well. And I'll be honest, it's actually way more fun than I thought it was going to be. I would not have signed up for it, but it has turned out to be one of the most joyful parts.
Thank you. And if you don't mind sharing, what's the secret to the messaging that you've discovered so far? Because like you said, it's all about marketing and just finding that thing that resonates with people. Have you found any key insights that you're happy to share?
Gosh, I'd love to know other people's insights because I'm still figuring it out. But I think that when you connect with people, right? So especially when it's something I'm not selling something pretty, right? I'm not selling something that fixes you. I'm selling something that is out in the future. So my connection with people comes from I think, telling stories, whether they're my own personal stories or stories of patients, and speaking to the fear without naming it as fear. Because I think that is where patients connect with me, right? They feel fearful of dementia. They feel fearful of the future. But I don't want to say, oh, it's going to be dark, ugly, and full of doom and gloom out there, so you better come see me. Then nobody's going to come talk to you. But if you talk about it in terms of stories of hope, connection, family, love, relationship, I think those are really what has connected most. It's been patients who've said, I read your website and your story of your family and how you got to doing what you're doing. Or I saw, I was at your speaker event and you talked about a patient interaction that really moved you. So I think those are the stories that you have to tell in order to sell something that does not intrinsically have a beautiful face. If I wanted to do as a neurologist, in my previous life, I did Botox for migraine all the time. And if you do enough Botox for migraine, you can start to get rid of people's wrinkles too, because you just know where to put it. And my husband would say, if you wanted something easy, you should have just done Botox. So I'm not doing Botox. I'm doing something that has a uncomfortable face that people just kind of want to turn away from. So you have to bring, I think, beauty to the story.
Got it. So you mentioned about being a founder just now, and that involves wearing lots of hats, many of which are non-clinical. Which of the non-clinical aspects of your role do you enjoy, and which are time drains and things you would rather not to have to do?
Well, I quickly learned that a time drain was bookkeeping. I tried to do all my bookkeeping myself because I figured I could, but that was a complete waste of time. So that was probably one of the first things I gave up. I still know how to read a balance sheet, so you still need to do all those things. But you can have somebody else to do the mind day to day. I think things like scheduling, you can have somebody manage your calendar. If at the beginning, you don't necessarily need that, but I think it's more efficient to have somebody manage your calendar with a goal, not just managing it, but saying, I want my schedule filled, and this is what is non-negotiable in terms of my calendar. I think that things I do, but I don't necessarily enjoy. I do my own video editing, and I'm terrible at it. So if you watch my YouTube videos, for example, I apologize in advance. That's my own editing. I'm hoping to have somebody help me with that soon. I really enjoy the writing. I enjoy writing blogs and newsletters, and I do enjoy filming the YouTube videos and figure out what I'm going to be talking about. I think that's content creation, and I feel really interested in. So it's more fun than I thought it would be. I love speaker events. I'm not a person who ever thought I'd like public speaking, but if you are talking about something that's important to you and you want to convey its importance to patients, it really comes easily, I think. And again, incorporating those stories into that. I like doing that. What else do I do? The part I don't love doing is going door to door to referring and, referrers, because it's awkward. As a physician in traditional insurance-based practice, I never had to ask people to send me patients. My schedule was booking out, a year. So 6 months to a year. So now having to find those people, it's not a question of not wanting to speak to them, but most of the time you don't get to speak to them. You're speaking to a secretary or a front desk person. And I don't enjoy that because I just feel like, is my rack card just going straight into the garbage? But you have to do it because you never know. You do 100 of those and you might get a few referrals, and those few referrals end up compounding over time.
Thank you. So HealthSpan Neurology is a relatively new thing. They're fairly new into it. What are you most proud of so far? What do you think is going particularly well for you in the business?
I'm most proud of my practice model. I think it works. I think I've seen when I say the clinical outcomes, I mean both objectively, just following data with patients over time, but most importantly, I think how they have changed their mindset from fear to one of agency. I think that's priceless. And that's really the most joyful thing that I feel I have done. And every time I see a patient, I come out of it just like beaming. I'm just full. So that's perhaps the thing I'm most proud of. I'm also proud of this, like from a personal level, I'm proud of the speaker events. Cause like I said, I'm a shy introvert. I don't like talking to people. I mean, I'm that person at the cocktail party who would rather slink out. But there I am, enjoying talking on a stage sometimes. So that's well outside my comfort zone. Friends who have seen me do it think that is a different person than the one that they know who slinks out of the cocktail party.
Got it. And on the other side of the coin, which challenges or bottlenecks are most impactful for your business at the moment? And what are you kind of working through or trying to overcome?
I think the most impactful are actually those two things that I'm good at, because I think the patients then leave me a review. And it's been surprising how patients have actually found me on Google. So I think that when a patient leaves you a Google review, or, I have a card that I ask them, that's a tricky thing to do, but I've gotten used to it. So that's been impactful. And then the speaker events are impactful. in terms of what's not been so impactful, I think that was your question. Is that right?
I was just interested in any particular challenges or bottlenecks that you're working through as a relatively new business that are most impactful to your business at the moment, and how are you kind of viewing them and how are you trying to solve them?
I think the most difficult one is I practice in Rochester, New York, which is a wonderful medical community. The University of Rochester is here and is an excellent medical center. But given their excellence, it is also difficult to work within a system work within a community that is, I don't want to use the word monopolized, but somewhat monopolized by a university center. And that is challenging. So to talk to physicians within that center, like I said, I can't get past the front desk. So that is a difficulty. So I just am not doing it as much anymore. And instead going to other sources of where my patients might be. So for example, a dementia prevention that's a person who's a forward thinker, who's thinking of the long game. So that's going to be things like, I wouldn't have ever guessed, but things like financial planners, estate planners. So it's thinking outside of the box. So that's how I gone about that. And also then seeing people within the whole of New York State virtually. So doing telemedicine, setting up my practice model so that it's something that can be done virtually, so that I can do all my testing through, say, remote cognitive testing and things like that, so that it is available to those throughout the state, so that I'm not limited to just a Rochester-based brick and mortar practice.
Now, you've been talking a little bit about your marketing efforts, and I just wondered what would happen if you had a sudden influx of new patients next week. I know 15 new patients next week.
Yeah.
What would happen? Would anything break? And hopefully not you.
That's a great question. I've thought about that, but it's never happened. So, so the way I've built my practice model is that I ideally see 5 to 10 new patients a month, because they come in for 3 to 4 visits over the course of 6 months to a year. That is a very doable model. And I think 15 new patients next week, if it continued over the next, every week was 15 new patients, I would probably need to hire somebody to help work with me. Having said that is tricky because I have very high standards, but I think that's only a good thing. Fortunately, I think that there are a lot of good people out there that might be wanting to work within a similar practice model. I guess I'd have to start recruiting pretty quickly, but I'm going to hope that that's a problem I have to solve soon.
Nice problem to have for some people.
Yeah, exactly.
And if you had a magic wand and you could fix one thing in the business tomorrow, what would that be, if anything?
It would be that people know that dementia prevention and cognitive longevity are the same thing, and they require that you start early. That isn't necessarily a business. It's not a framework of my business, but it certainly is a framework of what my business needs to educate people on. So if I could, have a wand, I would have 60 minutes do a 1 hour talk, and not 60 minutes, probably like a morning show, because 60 minutes is targeted to those who are older, but a morning show or something that really would, in an alluring way, encourage people to start looking at this early. From a practice standpoint, the one thing I would want is to have a means of really reaching out to my physician community where I am located, to educate them of how valuable what I offer is. And I feel very limited in that because of where I practice and the kind of environment I'm in, but it can change. You just have to peck away at it long enough.
So it's really an awareness thing, an awareness to patients, and also an awareness to colleagues about what you can do.
Because colleagues also are sending me patients who have dementia or significant mild cognitive impairment, rather than those that are who might have been thinking about it or concerned 15, 20 years prior to symptom onset.
Got it. So thinking to the future, where would you like the business to be in the next 6 to 12 months? Do you have any particular plans for how things are going to pan out for you?
Yeah, these are great questions. So ideally, I'd like to see the practice grow in terms of patient volume. I'd like to be able to reach more patients within New York State. And that's interesting because, Google and AI search is so interesting in how patients are finding me from throughout the state. And maybe over time, branch out to other states as well. I have some family and times that I'd like to spend in other places in the country. So maybe branch out to other states and really firm up my practice model so that it becomes one that is scalable and one that I can help others model as well.
Brilliant. And finally, if you were to start HealthSpan Neurology again tomorrow with everything that you know and the benefit of hindsight, which is a wonderful thing, would you do anything differently?
Yes, I would. I would have started to brand myself when I started thinking about my exit. So I would have started a YouTube channel and an Instagram presence and built my website well before, so that patients that I had at the time could find me, that they had a landing page, that they could stay connected to me. Obviously, like most physicians, there are people that I miss from building a relationship with them for 22 years. I think of them often. And, I'm not legally able to reach out to them, but they would be able to reach out to me if they knew where to find me. And I wish I had, even if it wasn't as a patient, I wish that they knew where to find me and they still had that connection. And then even if they didn't come to see me as a patient, they might spread the word and refer me to others, or if they were in a conversation with their doctor, be able to say, she's out there. So anybody who's thinking about leaving their traditional practice of medicine, build your brand, your face, your voice. You are way more knowledgeable and smarter than so many people out there. Get yourself seen. Don't be shy. Don't be modest. You are a rock star. Own it. And eventually you will feel like you are there. I'm not sure I'm there. I know I'm not there yet, but every time I do something, even like this, I feel like I'm taking baby steps to own my greatness.
What a point to end on. Thank you for that such sage wiseness. I really, really appreciate it. And I really do appreciate this conversation. It's been great to have you on the show, Ashanthi.
Thank you.
Really insightful, especially your perspective on prevention and the gap in the current system. So thank you very much for joining me. Really appreciate it.
Pleasure, Andrew. Thank you. Thank you.